Especially with the introduction of the basic health care fund and universal health coverage. The young people are benefiting also from better education and enlightenment that is being delivered in schools and also through media. We fully support age-appropriate and culture-sensitive information and education being given to young people.
There is repositioning of the health promotion programming in the country. And right now we have an advisory forum called National Health Promotion Forum. The Health Promotion Division is working collaboratively with the state health promotion officers. We develop some materials together, some social and behavior change materials together. These materials were translated into local languages, into 5 languages. They are being used by the states. Issues of health cut across all sectors. So there should be health in every public policy.
The first commitment that being demonstrated is to have a health policy on health promotion, which exists. So the next step is to ensure the operationalization of that. So a lot of efforts are ongoing. There's the health promotion technical working group that do develop all the messages and then the best approaches to use to disseminate those messages, and also to have critical mass of people, especially at all the levels, the state level through the health promotion officers, and also at the local government level where they have the community mobilizers. The key influencers in communities are not left behind. Education in different constituencies. I mean, religious groups, community leaders groups, women groups, adolescent groups advocating so that we are all on the same page of that understanding.
I would like to see a Nigeria where there is an improvement in health-seeking behavior, where women are able to look after themselves, to have their routine examinations, to be able to benefit from all the measures that the health system is providing, especially with the introduction of the basic health care fund and universal health coverage. The young people are benefiting also from better education and enlightenment that is being delivered in schools and also through media. We fully support age-appropriate and culture-sensitive information and education being given to young people.
There is repositioning of the health promotion programming in the country. And right now we have an advisory forum called National Health Promotion Forum. The Health Promotion Division is working collaboratively with the state health promotion officers. We develop some materials together, some social and behavior change materials together. These materials were translated into local languages, into 5 languages. They are being used by the states. Issues of health cut across all sectors. So there should be health in every public policy. The first commitment that being demonstrated is to have a health policy
on health promotion which exists. So the next step is to ensure the operationalization of that. So a lot of efforts are ongoing. There is the promotion technical working group that do develop all the messages and then the best approaches to use to disseminate those messages, and also to have critical mass of people, especially at all the levels, the state level through the health promotion officers, and also at the local government level where they have the community mobilizers. The key influencers in communities are not left behind. Education in different constituencies. I mean, religious groups, community leaders groups, women groups, adolescent groups advocating so that we are all on the same page of that understanding.
I would like to see a Nigeria where there is an improvement in health-seeking behavior, where women are able to look after themselves, to have their routine examinations, to be able to benefit from all the measures that the health system is providing, especially with the introduction of the basic health care fund and universal health coverage. The young people are benefiting also from better education and enlightenment that is being delivered in schools and also through media. We fully support age-appropriate and culture-sensitive information and education being given to young people.
There is repositioning of the health promotion programming in the country. And right now we have an advisory forum called National Health Promotion Forum. The Health Promotion Division is working collaboratively with the state health promotion officers. We develop some materials together, some social and behavior change materials together. These materials were translated into local languages, into 5 languages. They are being used by the states. Issues of health cut across all sectors. So there should be health in every public policy.
The first commitment that being demonstrated is to have a health policy on health promotion which exists. So the next step is to ensure the operationalization of that. So a lot of efforts are ongoing. There is the promotion technical working group that do develop all the messages and then the best approaches to use to disseminate those messages, and also to have critical mass of people, especially at all the levels, the state level through the health promotion officers, and also at the local government level where they have the community mobilizers. The key influencers in communities are not left behind. Education in different constituencies. I mean, religious groups, community leaders groups, women groups, adolescent groups advocating so that we are all on the same page of that understanding.
I would like to see a Nigeria where there is an improvement in health-seeking behavior, where women are able to look after themselves, to have their routine examinations, to be able to benefit from all the measures that the health system is providing, especially with the introduction of the basic health care fund and universal health coverage. The young people are benefiting also from better education and enlightenment that is being delivered in schools and also through media. We fully support age-appropriate and culture-sensitive information and education being given to young people.
There is repositioning of the health promotion programming in the country. And right now we have an advisory forum called National Health Promotion Forum. The Health Promotion Division is working collaboratively with the state health promotion officers. We develop some materials together, some social and behavior change materials together. These materials were translated into local languages, into 5 languages. They are being used by the states. Issues of health cut across all sectors. So there should be health in every public policy.
The first commitment that being demonstrated is to have a health policy on health promotion, which exists. So the next step is to ensure the operationalization of that. So a lot of efforts are ongoing. There's the health promotion technical working group that do develop all the messages and then the best approaches to use to disseminate those messages, and also to have critical mass of people, especially at all the levels, the state level through the health promotion officers, and also at the local government level where they have the community mobilizers. The key influencers in communities are not left behind. Education, education, education in different constituencies. I mean, religious groups, community leaders groups, women groups, adolescent groups advocating so that we are all on the same page of that understanding.
I would like to see a Nigeria where there is an improvement in health-seeking behavior, where women are able to look after themselves, to have their routine examinations, to be able to benefit from all the measures that the health system is providing, especially with the introduction of the basic health care fund and universal health coverage. The young people are benefiting also from better education and enlightenment that is being delivered in schools and also through media. We fully support age-appropriate and culture-sensitive information and education being given to young people. I would like to see a Nigeria where there is an improvement in health-seeking behavior, where women are able to look after themselves, to have their routine examinations, to be able to benefit from all the measures that the health system is providing, especially with the introduction of the basic health care fund and universal health coverage. The young people are benefiting also from better education and enlightenment that is being delivered in schools and also through media. We fully support age-appropriate and culture-sensitive information and education being given to young people.
There is repositioning of the health promotion programming in the country. And right now we have an advisory forum called National Health Promotion Forum. The Health Promotion Division is working collaboratively with the state health promotion officers. We develop some materials together, some social and behavior change materials together. These materials were translated into local languages, into 5 languages. They are being used by the states. Issues of health cut across all sectors. So there should be health in every public policy.
The first commitment that being demonstrated is to have a health policy on health promotion, which exists. So the next step is to ensure the operationalization of that. So a lot of efforts are ongoing. There is the health promotion technical working group that do develop all the messages and then the best approaches to use to disseminate those messages, and also to have critical mass of people, especially at all the levels, the state level through the health promotion officers, and also at the local government level where they have the community mobilizers. The key influencers in communities are not left behind. Education, education, education in different constituencies. I mean, religious groups, community leaders groups, women groups, adolescent groups advocating so that we are all on the same page of that understanding.
I would like to see a Nigeria where there is an improvement in health seeking behavior, where women are able to look after themselves, to have their routine examinations, to be able to benefit from all the measures that the health system is providing, especially with the introduction of the basic health care fund and universal health coverage. The young people are benefiting also from better education and enlightenment that is being delivered in schools and also through media. We fully support age-appropriate and culture-sensitive information and education being given to young people.
There is repositioning of the health promotion programming in the country. And right now we have an advisory forum called National Health Promotion Forum. The Health Promotion Division is working collaboratively with the state health promotion officers. We develop some materials together, some social and behavior change materials together. These materials were translated into local languages, into 5 languages. They are being used by the states. Issues of health cut across all sectors. So there should be health in every public policy.
The first commitment that being demonstrated is to have a health policy on health promotion, which exists. So the next step is to ensure the operationalization of that. So a lot of efforts are ongoing. There is the health promotion technical working group that do develop all the messages and then the best approaches to use to disseminate those messages, and also to have critical mass of people, especially at all the levels, the state level through the health promotion officers, and also at the local government level where they have the community mobilizers. The key influencers in communities are not left behind. Education, education, education in different constituencies. I mean, religious groups, community leaders groups, women groups, adolescent groups advocating so that we are all on the same page of that understanding.
I would like to see a Nigeria where there is an improvement in health-seeking behavior, where women are able to look after themselves, to have their routine examinations, to be able to benefit from all the measures that the health system is providing, especially with the introduction of the basic health care fund and universal health coverage. The young people are benefiting also from better education and enlightenment that is being delivered in schools and also through media. We fully support age-appropriate and culture-sensitive information and education being given to young people.
There is repositioning of the health promotion programming in the country. And right now we have an advisory forum called National Health Promotion Forum. The Health Promotion Division is working collaboratively with the state health promotion officers. We develop some materials together, some social and behavior change materials together. These materials were translated into local languages, into 5 languages. They are being used by the states. Issues of health cut across all sectors. So there should be health in every public policy.
The first commitment that being demonstrated is to have a health policy on health promotion, which exists. So the next step is to ensure the operationalization of that. So a lot of efforts are ongoing. There is the health promotion technical working group that do develop all the messages and then the best approaches to use to disseminate those messages, and also to have critical mass of people, especially at all the levels, the state level through the health promotion officers, and also at the local government level where they have the community mobilizers. The key influencers in communities are not left behind. Education in different constituencies. I mean, religious groups, community leaders groups, women groups, adolescent groups advocating so that we are all on the same page of that understanding.
I would like to see a Nigeria where there is an improvement in health-seeking behavior, where women are able to look after themselves, to have their routine examinations, to be able to benefit from all the measures that the health system is providing, especially with the introduction of the basic health care fund and universal health coverage. The young people are benefiting also from better education and enlightenment that is being delivered in schools and also through media. We fully support age-appropriate and culture-sensitive information and education being given to young people.
There is repositioning of the health promotion programming in the country. And right now we have an advisory forum called National Health Promotion Forum. The Health Promotion Division is working collaboratively with the state health promotion officers. We develop some materials together, some social and behavior change materials together. These materials were translated into local languages, into 5 languages. They are being used by the states. Issues of health cut across all sectors. So there should be health in every public policy.
the first commitment that being demonstrated is to have a health policy on health promotion, which exists. So the next step is to ensure the operationalization of that. So a lot of efforts are ongoing. There is the health promotion technical working group that do develop all the messages and then the best approaches to use to disseminate those messages, and also to have critical mass of people, especially at all the levels, the state level through the health promotion officers, and also at the local government level where they have the community mobilizers. The key influencers in communities are not left behind. Education, education, education in different constituencies. I mean, religious groups, community leaders groups, women groups, adolescent groups advocating so that we are all on the same page of that understanding.
I would like to see a Nigeria where there is an improvement in health seeking behavior, where women are able to look after themselves, to have their routine examinations, to be able to benefit from all the measures that the health system is providing, especially with the introduction of the basic health care fund and universal health coverage. The young people are benefiting also from better education and enlightenment that is being delivered in schools and also through media. We fully support age-appropriate and culture-sensitive information and education being given to young people.
Please, can I have I am here?
Can I excuse myself after a few, maybe like yes, 10, then you will come and take this. When you leave. Senate President.
Okay. Okay. Mm-hmm. Hello. Hello, good morning. Can we please settle down? Thank you, everyone. Shall we please all rise? Shall we please all rise for the national anthem? Thereafter, we'll have the national prayers. We'll have the national anthem. Shall we together recite the national prayer? O God of creation, direct our noble cause, guide our leaders right, help our youth and truth to know, in love and honesty to grow, and living just and true, great lofty heights attain, to build a nation where peace and justice shall reign. Amen. Please be seated. I'd like to welcome all of us, especially this morning, particularly those who are participating virtually. At this moment, I'd like to recognize that we have with us the Honorable Minister. Thank you very much. So the protocol can start properly. The Chairman, Senate Committee on Health, Distinguished Senator Olori Egbe, the Honorable Minister of Health, who is our chief host today, Dr. Sage, the Honorable Minister of Women Affairs, Dame Pauline Talin, the Honorable Minister of Environment, Dr. Mohammed Abubakar, Abubakar, the Permanent Secretary and representatives of the Permanent Secretaries here present, directors, heads of parastatals and MDAs, development partners here present, led, I'm sure, by the World Health Organization country representative that I've seen, my Lord, temporal and spiritual, and the vibrant Nigerian media, which is an essential ingredient to what we are doing today, led by the president of NUJ. Very, very distinguished ladies and gentlemen. We are here to witness an epoch in the making. The integration of health promotion, wellness, and sanitation into our national package, and it is history in the making. We are surely on our way to better outcomes, better NDHS, and better ranking, I pray, on the global stage. Your Excellencies here present, honorable ministers, very distinguished guests, ladies and gentlemen. I'm sure that looking back in the very near future at the picture which I have tried to compress in one line, we shall all be glad to be part of this auspicious event that I'm sure will bring positive change to health indices in Nigeria. We are going to be on a very fast track this morning to ensure that everything that we have put on the agenda is attended to, and we do appreciate the fact, and I think they need a special round of applause, particularly to our own Minister of Women Affairs. She was the first minister to arrive this morning, and the Minister of Health and Minister of State are all excited to have here with us, because driving what we are about to make public today is going to ensure that more Nigerians, we build more healthy herds of Nigerians. Now, we are here this morning, like I've said earlier, to witness the public presentation of the National Health Promotion Policy and its ancillary strategic policy documents. The national presentation, of course, is all encompassing, and as we have as many speakers come to speak on the microphone, we'll be able to amplify the essence of why it is important to factor in health promotion. And at this point, without wasting too much of your time, I would like to invite the Permanent Secretary, Federal Minister of Health, Alhaji A.M. Abdullahi, who is ably represented by the Director of Hospital Services, Dr. Adebimpe Adebiyi, MNI, who actually started some of the documents that will be made for presentation today. Please, let's welcome her warmly.
To God indeed be all the glory. The honorable ministers, representatives of permanent secretaries, directors, representatives of our development partners led by the World Health Organization, distinguished ladies and gentlemen. It is indeed a delight, pleasure, privilege, and vantage opportunity for me to represent my permanent secretary, Alhaji Abdulaziz Mashi Abdullahi, who is unavoidably absent. He's here with us in the spirit, but unable to be present physically. And he has directed me to welcome everyone to this auspicious occasion of the launch of the National Health Promotion Policy and its ancillary documents. And I will just go straight to read his welcome address. I am most delighted to welcome you all to this important national presentation, ministerial launch, and dissemination of the National Health Promotion Policy 2019 and its ancillary strategic policy documents. This is aimed at providing guidance on actualization of the federal government's commitment to improve the health and well-being of Nigerians through the promotion of healthy lifestyle and universal health coverage. As we all know, The National Health Policy 2016 recognizes that Nigeria is saddled with an unbearable burden of communicable and non-communicable diseases. This is coupled with issues such as low level of health literacy, poor sanitation, and inadequate attention to key social determinants of health. Health promotion is a process of enabling people to increase control over their health and its determinants, and thereby improve their health. But the current poor health-seeking behavior of the Nigerian populace has made the occurrence of public health emergencies and most recently COVID-19 pandemic an area of urgent concern. Likewise, available evidence indicates that due to globalization and other factors, the country is experiencing drastic changes in disease patterns, with more people affected by cancers, diabetes, hypertension, mental health conditions, road traffic accidents, domestic violence, unsafe sex practices, insufficient physical activity, as well as unhealthy consumption patterns of alcohol and tobacco. Against this background, and in recognition of health promotion as an effective tool for individual and collective health actions aimed at preventing diseases, improving the health and well-being of the populace, ensuring a healthy society for all, the Federal Ministry of Health, in collaboration with stakeholders, revised the 2006 National Health Promotion Policy in line with current public health realities as well as global trends in health promotion practices. The revised National Health Promotion Policy 2019 is meant to empower the Nigerian populace to take timely actions in disease prevention, improving their health and well-being, as well as taking measures that ensure a healthy society. Meanwhile, the Federal Ministry of Health is poised to leverage the policy's ancillary strategic policy documents to ensure that health promotion steps out of its less successful past and become a formidable contributor to improving the health and well-being of the Nigerian populace. To achieve a successful national launch and eventual rollout of the revised policy and its strategic policy documents, it is important to secure the buy-in of all key stakeholders, including the National Assembly, well represented by the Chairman, Senate Committee on Health, ministries, departments, and agencies of governments at all levels, development partners, civil society organizations, traditional and religious leaders, the media, professional bodies, the private sector, non-governmental organizations, philanthropists, and community as well as faith-based organizations. In the course of this national launch, we will discuss efforts already made by the federal government to reposition health promotion programming for increased public visibility at national, state, and local government levels. Let me use this opportunity to appreciate our development partners, most especially UNICEF, WHO, NURI2, Lafia UK Support for Health in Nigeria, African Health Budget Network, USAID, funding Breakthrough and Action Nigeria, and Breakthrough Research Nigeria, CHAI, JSI, the Challenge Initiative, the CCSI, and sundry partners for your technical and financial support to this noble cause. The federal government looks forward to further collaboration and support from all of you. On behalf of the Federal Ministry of Health, I, that is Alhaji Abdulaziz Mashi Abdullahi, welcome you to the national presentation, ministerial launch, and dissemination of the National Health Promotion Policy 2019 and its ancillary strategic policy documents. I thank you all for your kind attention.
Thank you very much. All right, I have some list here. We have from the Director General NOA, Mrs. Ruth Ogun, is representing. We thank you very much. We also have the representative of Bishop Dr. Sunday Onoha, who is the Executive Director, NIFA, who is representing him, and His Eminence, the Sultan of Sokoto, and His Grace, the Khan President. We thank you very much for coming. We also have a representative from the DG Nigeria Governors Forum Secretariat. You're welcome. And also representing, we also have a representative from NAVDAC. And also have with us here the head of immunization, UNICEF, Dr. Anis Siddiq. You are all welcome. Well, we have also been welcomed, and I think we should move fast and appropriate. Our next speaker is one who is driven by passion. I'm sure if she wasn't a minister today, she probably would be at the local government area pushing for well-being and good health and promotion of inclusiveness and gender-based support. I'd like you to please, on our behalf, those of you out there virtually and those who are physically here, to welcome with me very well the Honorable Minister of Women Affairs. She has been Commissioner for Health. She has been chair at some point at the local government. She has been Deputy Governor in Plateau State, and she's here as Honorable Minister, as a friend and a sister. Sometimes it's difficult how best to introduce her, but this woman deserves a round of applause and our prayers for the energy that she has been dissipating. I do hope that with her orange and my orange, we are oranging this. We are oranging the world. Thank you.
Thank you very much. Thank you, my dear Sister Moji. My dear brothers, our chief host, the Honorable Minister of Health, Dr. Osage, and the Honorable Minister of State Health, Dr. Senator Mamara. I want to specially acknowledge and welcome the Chairman of the Senate Committee on Health. Distinguished Senator, you are most welcome. I acknowledge my dear brother, the Honorable Minister of Environment, Dr. Mahmoud. I acknowledge my dear brother, our partners led by the country rep of World Health Organization. I acknowledge the NUGA president, the representative of the permanent secretary, and all directors here, particularly my dear sister, the very hardworking Director of Family Health Department, Dr. Anas Kolo, who put pressure on me just this morning to be here. She said, if I don't come, her minister won't be happy. And I can't afford to upset my two brothers. I had to rearrange my program and ask one of my directors to represent me at another program. I was to be there for 9. Distinguished invited guests, gentlemen of the media, today is very, very strategic as we launch the national presentation and ministerial launch of and dissemination of National Health Promotion Policy 2019 and its strategic policy. This program, I'm sure all of you here will agree with me, that the main resource person to drive this health promotion is the Ministry of Women Affairs. Women are your greatest resource, and whatever affects the family, it is the woman, is the mother that handles all health issues that affects the family, both the husband and the children. Women and children suffer more from negative impacts of disease burden, and we cannot afford to drive this without putting the women at the center stage. I remember very clearly when I was Commissioner for Health on the Plateau, I emphasize more at the grassroots, because the grassroots is where we have more people. They are the ones that need more advocacy. They are the ones that need all our attention if we want to achieve universal health coverage. Women lack access to health facilities compared to men. Women are the most vulnerable in every sphere of life, but more attention should be given to women and children if we want to have healthy families. There are so many cultural practices that are unfavorable to women's access to health. In some cultures, a woman needs the husband's permission to access the health facility, or she must be dropped off by her husband or close male family member. I know of a case where a woman was in labor. The husband was not around, they couldn't reach her. She was struggling. No, she couldn't on her own leave the house to go to the hospital. By the time they got the husband and he took her, it was too late. She died and the baby died. And he was proud to say that she was doing the right thing because she could not leave the house to go to the hospital without his permission. This must stop, because women are not slaves. There must be human respect for human life. There must be human respect, and women need their dignity. The inclusion of women in health promotion would significantly increase the attainment of health objectives. Women have less economic power to pay for out-of-pocket health expenses. So there must be a deliberate policy that gives women better leverage. And that's why our traditional rulers, our religious leaders must be fully involved in this advocacy so that we can do away with these bad cultural practices that makes a woman a slave of burden, that she cannot access health facility unless she gets the husband's permission or a male member of the family. I call on all our religious leaders to emphasize more on this, to ensure that men treat women with respect and dignity as far as health issues are concerned. There is no duplicate to life, and everybody has the right to protect his life. And the fact that you are a married woman doesn't mean that you've become a slave, that at the point of even losing your life, you must be answerable to a man. I pray that all our men take this matter seriously. I'm happy the representative of the Sultan and Khan representative are here. Please, this is more an issue that you should champion and make sure that our women and our children have the leverage of getting access to health. Disease control, I believe prevention is better than cure. The control of our diseases is best managed again in the home, and the woman plays a critical role. I call on all women, both in the cities and in the villages, to take health issues very, very seriously, to take their families' health care issues very seriously. Women should champion this health promotion so that we can achieve the best we are praying for towards health coverage. Once again, I congratulate the 2 ministers and the chairman of the Senate committee for launching this health promotion policy 2019 and its auxiliary strategic policy documents. Congratulations and God bless.
Thank you very much, Honorable Minister. Women are very central to what we attempt to make public today, and I do hope that women at every level will be galvanized to see and embrace health as an investment. We are moving on quickly. I'd like to invite the Honorable Minister of Environment. Environment is important when we speak to sanitation and safe environment in which people can live and have a healthy life. So please welcome with me the Honorable Minister, Dr. Mohammed Mahmoud Abubakar.
All right. Thank you very much. Let me start by recognizing our legislative counterpart, distinguished Senator and Chairman, Senate Health Committee, and then the Honorable Minister of Health, my brother, Dr. Asagi, and my other Honorable Minister of State Health, Senator Mamara, also Honorable Minister. And then my sister, Dame Pauline Talen, Her Excellency, Deputy Governor and Minister of Women Affairs, our strategic partners, distinguished guests, ladies and gentlemen, good morning. Health, environment are intertwined. Actually, they're Siamese twins. You cannot separate the two. I'm pleased to be here today on this occasion of the ministerial launch and dissemination of revised National Health Promotion Policy 2019 and its ancillary strategic policy document. In a bid to tackle public health challenges, the Federal Ministry of Environment, in collaboration with other stakeholders, including the Federal Ministry of Health, is reviewing the National Environmental Sanitation Policy and its guidelines on pest and vector control, school sanitation, sanitary inspection of premises, solid waste management, and safe excreta and sewage disposal. The ministry has also established a National Environmental Health Surveillance Center for continuous and systemic collection, analysis, and interpretation of environmental and public health-related data needed for the planning, implementation, and evaluation of public health practice in Nigeria. The center, among others, serves as an early warning system for impending public health emergencies, identify environmental risk factors which can cause epidemic, and alert the health sector as well as the animal health sector on possible zoonosis, etc. The Federal Ministry of Environment is actively involved in the ongoing effort to contain the spread of the coronavirus in the country. We have disinfected over 200 federal premises in the FCT and carried out intervention activities in some states, trained environmental health officers, sanitation desk officers, and volunteers on COVID-19 containment, including management of related waste, sub-burial of corpses, etc. We have established a strong partnership with the Federal Ministry of Health in addressing environment and health-related issues in the country, including the development of the National Action Plan on Control and the Use of Mercury in Artisanal and Small-Scale Gold Mining, remediation of lead-contaminated sites as a result of artisanal and small-scale gold mining activities, and the prevention of lead poisoning, particularly in children. Also, tobacco control, malaria elimination, and neglected tropical diseases control programs. Health activities such as antimicrobial resistance, Lassa fever prevention and control, as well as food safety. The quality of the environment has consequences either positively or negatively on our health. We must therefore make sure our actions consciously made effort to avoid actions that will lead to the further degradation of the environment. Distinguished ladies and gentlemen, this background that I congratulate the Federal Ministry of Health for this bold initiative. The Federal Ministry of Environment is supportive of your activities and will continue to collaborate with you in our shared vision of ensuring sustainable development and a healthy environment. Because if we do our job very well together, as we all know, Diseases are usually environmentally based, 70–80%. If we can come together and do that, the health and the environment can sustain a very healthy environment and therefore healthy and productive people. Thank you and God bless.
Are you going to leave it?
One now?
Yeah. It's not good. Okay. Thank you very much, Honorable Minister of the Environment. Yes, we understand that Her Excellency will have to take leave of us. We wish you a productive week ahead. Thank you. We are moving on, and at this point, I'd like now to call on collaborative remarks. We're going to start, of course, from home. So may I please invite the representative of His Eminence here with us, who is representing His Eminence and His Grace, the Sultan of Sokoto and the Khan President. Can I please have the representative, if you're around? If you are not around, we'll move on to the next. Okay, we'll move on to the next speaker, but please, you have only 2 minutes, and if you make it less, that'll be wonderful, so that we can have robust hearing and robust presentation here today. So next, I would just ask that the Executive Director of the National Primary Healthcare Development Agency is being represented here today. And are you speaking, or you have the speech to speak? Okay. All right. Thank you. You have the floor, please. Thank you.
Good morning, Honorable Minister. Good morning, the distinguished Senator. Good morning, everybody. Let me operate from the established protocols. This is a good message from the National Primary Healthcare Development Agency, led by our dynamic Chief Executive, Dr. Faiza Shuaibu. The National Primary Healthcare Development Agency, we all know, is the first son of the Ministry of Health, and saddled with several responsibilities. The launch today, the National Primary Healthcare has played a major strategic role in the development, and we congratulate the Department of Family Health and the Federal Ministry of Health as a whole, and the Division of National Division of Health Promotion on this major field. It suffices to say that the National Primary Health Care, with its mandate, supporting states and AGS to implement primary health care, is virtually in all our communities and in all states and AGS. And with over 40,000 PSCs, and of course, 70% of our people stay in the community, we have no other option than to use appropriate tools and strategies to do that. And one of the major strategies we use is the health promotion strategy. And I want to also say that during the peak of the COVID, the agency was able to train more than 200,000 health workers on health promotion practices. And of course, we were able to reposition health promotion materials and infrastructures at different places. And having said this, as the first son of the Federal Ministry of Health, we have no option than to use the tool. It's like a prescription. Use the tool the ministry has given us to operate. The launch today is a tool for us to do our work better at the communities, at the health facilities, and to make sure that our people get the right information and do the right practice. So on behalf of my chief executive, who would have been here personally, I want to say congratulations to the honorable ministers and to the ministry as a whole for this launch today. And we will continue to work assiduously to make sure that all the tenets of this policy is obeyed and is adhered to. It's going to be our major tool, and we are going to make sure that there's no stone that will be left unturned to make sure that the health promotion policy is adhered to. And we will also encourage our health promotion division to be more regular in the quarterly meetings and then from activities, so that we'll be on the same page with our Prime Minister. This I have said, and I have been directed to convey and to congratulate the Honorable Minister once again and the Director of Family Health Department on this major feat. Congratulations. Thank you.
Thank you very much. We are quickly moving on to the representative of the Director General NAFDAC, and it's been represented today by Fraden Bitrus, Deputy Director of Pharmacovigilance, which also I'm sure is very germane to what we're doing here today. You have the mic.
Thank you very much. I want to sincerely thank the Ministry of Health for this invitation. I want to take your permission to stand on the existing protocol. The National Health Policy 2016 acknowledges that Nigeria has a heavy burden of communicable and non-communicable diseases. This is coupled with issues such as low levels of health literacy, poor sanitation, and inadequate attention to key social determinants of the health. The revised National Health Promotion Policy 2019 is meant to contribute to achieving Nigeria's national health policy commitment, which is to deliver health care that is preventive, promotive, restorative, and rehabilitative to every citizen of Nigeria. NAFDAC, as a regulatory agency, is saddled with a responsibility to ensure that quality, safe, and efficacious medicines and wholesome foods are made available for the citizens. NAFDAC is committed towards ensuring that the level of standard and falsified medicines which can affect the health of the citizens are brought to the barest minimum. The agency is not unaware of the impact of high sodium, high levels of unsaturated fats, and high sugar content in processed foods, on which affect the prognosis of non-communicable diseases such as hypertension, arteriosclerosis, and diabetes. In view of this, NAFDAC is also working towards ensuring that sodium, sugar, and unsaturated fat contents of processed foods are in line with international standards to curb the menace. NAFDAC is also committed towards promotion of exclusive breastfeeding for infants up to 6 months and enforcement of the regulation for marketing of breast milk substitutes in Nigeria. NAFDAC will work and collaborate with all relevant stakeholders to ensure the implementation of this policy. Thank you very much.
Thank you very much for that encouraging remark of collaboration. Next, I would like to invite the representative of the Director General Nigeria Governors Forum, Chinekwe Ore, who is a health specialist. Shall we please welcome her? Thank you. 2 minutes.
Thank you very much, Madam. I want to acknowledge the Honorable Minister of Health and the Honorable Minister States for Health and all the ministers here present, and also the chairperson of the Senate Committee on Health. Please permit me to stand on existing protocols. First of all, we want to thank the Federal Ministry of Health for inviting the Nigeria Governors Forum to be a part of this launch. And I want to send in the apologies of our Director General, who would have wanted to be here, but because of some prevailing circumstances, was not able to make it to this place this morning. But he sent his regards. I want to congratulate the Federal Ministry of Health on the launch of the National Health Promotion Policy and other strategic policy documents. The Nigeria Governors Forum is the platform that brings together all the 36 state governors, where they discuss issues of common interest around good governance and sustainable development. And health is a priority of the Nigeria Governors Forum. And we recognize that health promotion is critical towards driving sustainable development in health, particularly with the rising numbers around the non-communicable diseases. So we understand the import of what we are doing today. We also acknowledge the role that health promotion has played in the pandemic, with the health promotion officers playing critical roles in the risk communication pillar of the COVID-19 response. So we know that this health promotion policy and every other strategic document is very important, and the NGF commits to push the states to domesticate the implementation of these policies at the subnational level. We look forward to partnering with the Federal Ministry of Health and other stakeholders to drive this agenda. And at this point, we also want to request that at least 40 copies of the policy documents will be given to us so we can distribute same to the governors and all the states to ensure that they are on the same page with what is happening here. Thank you very much.
Thank you very much. When the drive for health reforms started about a decade or more than a decade ago, it was important to ensure that all policies are cascaded and domesticated at the state level. So the Nigerian Governors Forum has become that tool who would help to push this. We thank you very much for coming. We go straight back to from the Nigeria Center for Disease Control, NCDC. We have a representative of the Director General here, Dr. Chinwe Ochu. You have the floor. Please, the protocol has been established, so just go straight. Thank you.
Thank you very much. I stand on existing protocols. I want to sincerely appreciate our own minister, the Honorable Minister of Health, and the entire team for this privilege to stand to represent my Director General, who is Dr. Chikwe Ihekwazu, who is unavoidably absent and is very much with us in the spirit. He extends his regards. A big congratulations for this great occasion of launching the National Health Promotion Policy. We at the Nigeria Center for Disease Control, we are very happy to be part of this. The NCDC is the National Public Health Institute that has been mandated to protect the health of Nigerians from infectious diseases of public health importance. And health promotion has been a critical component of our strategy. We have been involved in risk communication and community engagement efforts, infection prevention and control. The COVID-19 outbreak has seen us establishing infection prevention and control programs in all the tertiary health facilities in the country, and our goal is to have this also in all the secondary health facilities and even at the primary health care level. Health promotion is very important for us as a country. It is underpinned by the concept of salutogenesis rather than pathogenesis, thinking health rather than thinking disease. How do we ensure that people stay healthy? Health is a universal product that is achieved only through universal efforts. It cuts across all sectors, segments, and community groups. It is everybody's business. And I think the COVID-19 outbreak has shown us clearly that health is multi-sectoral. Health is not just limited to the health sector. Health promotion means thinking health in all our policies, making healthy public policies, not just public health policies. What it means is that all ministries in their policies think about how those policies will affect health. Such healthy public policies will make it easier for people to make the healthy choice. It is about policies that enable our youth not to choose tobacco use as an option. It is about a built environment that supports regular physical exercise by the public and improves general health in our schools, in our offices, in our businesses, in construction of roads, making sure we have an aspect that promotes pedestrian exercise. We have such systems and structures in place to promote health. It's about engaging communities in the development and implementation of health policies and projects so that they take ownership, engaging these communities in decision-making for their own health. It is about universal health coverage that improves our access to health care. It is about health education that makes information available to the public so that they can take informed decisions about their health and improve their health-seeking behavior. It is about basic healthcare provision. It is about strengthening our primary healthcare system. Health promotion is a compelling choice globally, and more so in a nation like Nigeria with very limited resources. This launch is a wake-up call to all ministries, departments, agencies, civil society groups, religious and traditional organizations, and all other organized sector, and even the Nigerians, to think health in all our policies and actions. Honorable ministers here present, ladies and gentlemen, may I end this collaborative speech by giving us an illustration of the difference between salutogenesis that underpins health promotion and palutogenesis. It's like a river with people falling into the river and people going to the river to drag out people and save those that are drowning in the river. Which will be easier? Is it to pull people out of the river or to even stop people from falling into the river? Trying to rescue people from the river is more resource intensive. And before you know it, the healthcare workers will be overwhelmed and they will not be able to do the job. But if we work at preventing people from falling into the river, we will be able to achieve more, and we'll be able to achieve our goal of a healthy country. Thank you very much, and congratulations again.
Thank you. I think the option of not allowing people to go to the river will be the best. I don't, for example, I can't swim. So it'll be difficult. It'll be difficult to save anybody. So I'm sure we're amplifying the fact that prevention is better than cure. Yes, just before I call on the next speaker, I'd like to recognize that we have with us the Executive Director, Nigeria Interfaith Action Society, NIFA. He's representing His Eminence, the Sultan, and His Grace, the Khan President. I'd like to welcome my Lord Bishop, Dr. Sunday Onoha. Sir, you're welcome. It's good to see you again. We move on now to where the messages should go, and I always insist that if we want the message to work, then we must take it to the grassroots level, and we must begin to ensure that these messages are in local languages so that the people who need them, all of us, would understand what we need to do as individuals to promote health, a healthy well-being. So it's important that we have with us the National Orientation Agency. They have an office everywhere, every place in Nigeria. Let me invite Mrs. Ruth Organ, representing Dr. Garba Abari, to give their collaborative message. Thank you, ma'am.
Standing on the established protocols, on behalf of my Director General, Dr. Garba Abari, who would have loved to be here, but absent due to other pre-scheduled national assignments, he sends his warm regards and apologies. We express our profound appreciation that we are part of this epoch-making event that seeks to make health delivery affordable to all. The National Orientation Agency is a partner on this project, and we want to commit to continue to ensure that the understanding of this policy is down to the grassroots. And it is to achieve support and active participation of all. We want to also commit to making available our robust structures and skilled community mobilization officers to engage citizens with this policy. We are ready to work with and through our community-based organizations as partners to get the messages down to the household. We, at this point, want to congratulate the Senate Committee and the Federal Ministry of Health on this great achievement, and we will ensure that the policy is understood so that the people at the grassroots can make informed decisions and change behavior. Thank you very much.
Thank you very much. Thank you. We'll go straight now. We're going virtual, and I understand that the chairperson, Health Commissioners Forum, is online. Dr. Edu, you have the floor now. Let's hear from you, please. Thank you. 2 minutes.
Good morning, and thank you for having me, the Honorable Minister for Health, and all the other ministers on the stage. Due respect to every other member present at this meeting, I'm happy to be part of the ministerial launch and dissemination of the revised National Health Promotion Policy and its auxiliary strategic policy documents on behalf of all the commissioners for health. We commit to full delivery of these policies in our various communities. We cannot achieve universal health coverage if we do not improve on health promotion. It's important for us to understand the sensitivity of health promotion and the reason to avoid certain areas, especially sensitive areas when it has to do with religion, culture, tribe, and other indices that should be properly taken into consideration as we go about promoting health. It would also be important for us to state that at the state level, we have very robust system that can take information to the grassroots. Of course, from the state ministries of health to primary healthcare development agencies, the state health educators, the state mobilization officers, health promotion officers at the local government, health workers, community volunteers at the local government levels that can take health information to the grassroots. At the point where we have the transition in the demographics, at the point where we have both communicable and non-communicable diseases thriving at almost an equivalent rate, it's important for us to improve on health promotion so we can keep people healthy, we can help them improve on their lifestyle, we can help them improve on their lifespan, and we can make better decisions at all levels. Finally, we must commend the Minister for Health and indeed Nigeria for this policy. We believe that it's not going to be like all other policies or some of the policies that just get launched and action is not put to words, action is not put to document. We want to believe that this will go down to the grassroots and every stakeholder will get involved in full implementation of these health promotion policies. On behalf of all the commissioners for health in Nigeria, we commit to the full implementation of health policy and promotion policy in our various states and local governments. Thank you for having us.
Thank you very much, and thank you for that show of solidarity. At this point, honorable ministers, very distinguished ladies and gentlemen, it is important that if we are speaking to health promotion, then we must carry the media along. I'm sure I probably would not be invited to anchor this if I didn't belong to the media. And so and we have a constitutional right to be part of what is happening. So it is on this premise and with a sense of pride and collaboration that I invite the national president of the Nigerian Union of Journalists, Mr. Chris Isiguzo, to please save for us, make it public, what the media would commit to. Thank you. And I think my president deserves a round of applause.
Thank you very much, distinguished ladies and gentlemen. May I join other speakers to stand on already established protocol? We are so pleased to be part of this event today, a national presentation, ministerial launch, and dissemination of the National Health Promotion Policy 2019 and its ancillary strategic policy document. I am particularly happy that the ministry has deemed it necessary to gather stakeholders, all stakeholders, to be part of this engagement today, because all of us must have to contribute, play our own unique roles towards ensuring that the essence of this policy document is achieved. I'm also happy that the commissioners for health from the states have also committed to be part of this. I want to believe that healthcare delivery is key, is pivotal, is central to having a prosperous country. More so at this time when we are faced with the rampaging COVID-19 pandemic and, of course, other diseases that line up in our system. It therefore becomes imperative that we must have such a document which speaks to us on the essence of having or leading a healthy life. I must have to also observe that it's not just about launching the document, presenting the document here. Our governors must be effectively carried along because as NUJ president, I've had the opportunity of going around the country, the 36 states, and I must say that what we see across the states is not encouraging. Our primary healthcare delivery system is in comatose. The secondary healthcare delivery system is practically packed up at the state levels. And that's why we obviously put enormous pressure on the tertiary healthcare delivery system. Therefore, it's important that we must activate these levels of healthcare deliveries at those levels, to make them begin to work. That's the only way we are going to ensure full implementation of the contents of this policy document. Anyways, I want to congratulate the Honorable Minister for Health and, of course, Minister of State and all the people that have made contributions towards ensuring that this event today becomes a reality. I want to, on behalf of members of the Nigeria Union of Journalists, commit that we will also discharge our own roles, the responsibility that has been entrusted in our hands. We can assure you that we'll make sure we live up to expectation by taking this message to every nook and cranny of the Federal Republic of Nigeria. Once again, congratulations. Thank you.
Thank you very much, President of NUJ. I can assure you that you will get a robust publication and visibility for this event with the NUJ President's presence here with us. We're still within the media. I'd like to invite the representative, and this is the final on the collaborative remarks, President, Newspapers Proprietors Association of Nigeria. We have a representative here of our brother. Thank you very much. Aha. You are not applauding the media. Okay.
Thank you very much. The Honorable Minister, I stand on the existing protocols. Well, I represent Prince Unduka Obaigbena. My name is Bola Jadebi, editor of This Day. He sends his regards and congratulates the Ministers of Health and his colleague for the formulation and presentation of this policy. He pledges our various platforms, both electronic, print, and social media, for the promotion of health and this policy. This day especially has always been a collaborator in the efforts to promote health. I will recall that we were in the forefront of the lobby for the 1% consolidated revenue fund for health care. We will continue to support health promotion in whatever way we can and in whichever way it is requested. So he thanks the Honorable Minister of Health for this opportunity and privilege. Thank you very much.
Thank you very much. Before we call on our development partners, we'll have to build a good bridge of tradition and culture and, of course, religion that is very important to us in Nigeria. On behalf of those institutions, I'd like to invite my Lord Bishop, Dr. Sunday Onoha, to please give us their collaborative speech in 2 minutes, sir. Thank you.
Thanks, Moji. Honorable Minister and Minister of State, and brothers and sisters, in this very important outing of National Health Promotion Policy, I stand here on behalf of the Sultan of Sokoto, His Eminence, and the President of Christian Association of Nigeria to give our credence and blessing to this program and policy, and to say that the faith community, as it has been our tradition through the years, to support this program. And in doing this, we want to offer Honorable Minister, during the first quarter of next year, that we convene a very important faith leaders high-level engagement with your office, because the faith community do not want to be approached when there is a problem. We want to be part of the process of making sure that there is no problem. And so we want to be part and parcel of the project, and you engage with the highest level of faith leaders in Nigeria, both Muslims and Christians. And we have realized that when people are sick, they are sick as human beings. They are not sick as Muslims. They are not sick as Christians. It is the blood that runs in our vein. The blood in our vein knows no religion and does not belong to any religion, but belongs to all religions. Honorable Minister, we are with you in this journey and we walk with you all through. God bless you.
Thank you very much. I think he deserves a very loud round of applause, echoing the fact that diseases don't have borders, they do not recognize religion, tribe, gender. Disease is disease, and all of us must be involved in the promotion to eliminate, to eradicate, as it were, and to contain any spread of disease. Thank you, sir. You can see at the background here and elsewhere that our various partners have contributed to today's event. We want to thank them immensely for their contribution. We'll move on now to goodwill messages, and please, I'm still adhering, I'm still begging that we keep it within the 2 minutes limit. We're going to start from our partners from the United Nations. WHO is here. May I please invite you, sir, to the microphone, the country representative of WHO. Please, let's welcome him warmly.
Thank you, my auntie Moji. the Honorable Minister of Health, Minister of State, Chairman of Senate Committee on Health, distinguished guests, the invitees, please permit me to stand on existing protocol. I just have a few words to say thank you. Thank you, Honorable Minister of Health, for having WHO and other partners to be witness and part of this launch. I want to emphasize a few points. The first one is universal health coverage is first and foremost a political choice. From the highest level, Nigeria has chosen to revitalize primary health care as a bedrock, as a path to achieving universal health coverage. But without health promotion, without proper policies in place, there will be an implementation gap. I'm truly excited to witness the launch of the National Health Promotion Policy, the revised policy, and its ancillary strategic document. It's important for us all to note that this is just a start of a process rather than the end in itself. The statement in the Ottawa Charter on health promotion emphasizing a process to allow communities to take control of their health and the determinant of their health. That's the end. So long as the communities will not be able to take control of their health and the determinant, we will not succeed, will not achieve the purpose of this launch today. And this is why I want to commit again the WHO to support the Minister of Health, the whole of government, the whole of society, to achieve this noble goal until such time that will be set through. Thank you again, Honorable Minister, and congratulations, big congratulations for this great achievement. Thank you.
Thank you. I'd like to invite the UNICEF rep here present with us, Head of Immunization, Dr. Siddiq. Thank you.
Thank you very much, and all protocol duly observed, but I would like to congratulate the Honorable Health Minister for his leadership. I think this is probably the first health promotion policy I ever heard around the world. Probably this is that Nigeria should feel proud of. I never heard any country has developed a national health promotion policy. And this is basically the health promotion and health education is the center point and very close to UNICEF work. And particularly, I am very delighted because 3 years back when it started reviving, I was part of a workshop, and today I see that this is what is really taking shape. And I would like to thank the whole team and Ministry of Health on behalf of our representative, Mr. Peter Hawkins. Thank you very much.
Thank you very much. It's a first, and we hope that every effort will be made to make it sustainable and useful for the citizens. We're moving on to other partners here, and I hear they are online. From USAID, we'll be listening in to Emma Kofa-Mitro. Is she online, please?
Yes, I am.
Okay, thank you. Good morning. You have
Good morning.
the mic, yes.
Thank you. Good morning, and kindly allow me to stand on established protocols. My name is Emma Kofa-Mitro, and I am pleased to be here today to bring you goodwill from the United States Agency for International Development. Through USAID, the United States has for several years supported Nigeria through investments in health and education, economic growth, peace and security, democracy, human rights, and governance. This support is consistent with Nigeria's repositioning of health promotion as an essential component of the public health programs and in alignment with the principles and goals of the 2019 National Health Promotion Policy and its strategic plan. USAID investments collaborate with the national, subnational, and community level structures and actors to catalyze positive shifts in health seeking behaviors, shape demand for health products and services, improve provider behaviors, and foster supportive social norms. USAID believes that this revised national health promotion policy provides the much needed roadmap for effective repositioning of health promotion in Nigeria. Adequate funding for health promotion strategies as part of routine and innovative health financing options is a cost-effective way to reduce the burden of disease and to improve population health, and indeed accrue cost savings for the health system. On behalf of the donor community, I congratulate Nigeria under the stewardship of the Honorable Minister of Health on these important policy advancements. Thank you for your kind attention.
Thank you so very much. I've been instructed that Dr. Mujio Deku will speak before we have the Bill and Melinda Gates Foundation representative speak. Dr. Deku, you have the floor for as fast as you can make it. Thank you, namesake. Please come on.
Thank you very much, namesake. I'll do like 60 seconds because of time. I would like to take permission to stand on the established protocol and bring greetings from the John Hopkins Center for Communications Programs. We are delighted because we've always been a traditional supporter of health behavior change for promoting quality health. It's our dream today that many efforts that's gone thus far in ensuring that health promotion or health education related issues bring to the bear the visibility of its role in promoting quality health, we are actually achieving it today. It's such a landmark thing that we also have guidelines and policies for the very first time, and that orientation has actually been given to those who will really put power where the rubber hits the road, which is the states and the local government. For the first time, government of Nigeria has actually gone to ensure these documents get to the local government, all the 774 local government. I think this is kudos to the leadership of the Honorable Minister of Health and the Honorable Minister of State for Health. We are indeed in an innovative era. They were even oriented on how to use. Wow, this is great. This is a new season. And so we join to congratulate all stakeholders, all supporters, and those who will implement that this energy will continue and will bring us to that for where the indices of Nigeria will become an enviable one as Nigeria stands tall amongst community of nations. Thank you very much for this time. Over and out.
Thank you. Thank you very much. Indeed, over and out, yes. We are still virtual, so we'll go on to the representative of the Bill and Melinda Gates Foundation, Rodio Diallo. You have the floor.
The Honorable Minister of Health, the Honorable Minister of State for Health, Director, Family Health Department, Head Health Promotion Division, stakeholders, ladies and gentlemen, all other protocols duly observed. It is always a pleasure for the Bill and Melinda Gates Foundation to be part of the success stories in the health sector in Nigeria, particularly in these trying times of the global COVID-19 pandemic, where every success story counts at this time. Health promotion is taking a new dimension as health is seen as the resource for life. Globally, more than ever, promoting health is taking the center stage in ensuring preventive health situations rather than curative, as can be seen with the COVID-19 pandemic and other public health issues we face. The advancement of health promotion in Nigeria as a public health strategy is one that is still evolving but will require urgent implementation actions to achieve the kind of outcomes we all hope for. For individuals to adopt a healthy lifestyle, innovative ideas will be needed to drive health promotion. This will involve community participation and approaches that promote ownership, collective planning, and a logical approach to defining problems. Collaborative partnerships are also fundamental to health promotion practice, and understanding how to influence activities and policies is critical. This can be a powerful tool for changing the health of the populations. It is important that public policies are developed to protect and promote health, and this is not confined to the health sector alone. Housing, employment, education, and environment protection policies can also have both a direct and indirect impact on the health of individuals and communities. Evidence should drive policy development, and measuring the impact of policies on health is important to gauge their effectiveness. Also, a knowledge-driven model is essential where new knowledge creates a push for its application in policy and where knowledge informs the decision-making process. Lastly, I would like to mention that social and behavior change communication is critical to promoting the adoption of healthy behavior from the individual and community levels all the way to the systems level. Mass communication is important in raising awareness of health issues and in securing public and political support. Needless to say, the value of positive digital and social media use cannot be overemphasized in these times. It is indeed with great joy and a sense of responsibility that the Bill and Melinda Gates Foundation, through its sector-wide ongoing support, joins the Federal Ministry of Health, in particular the Health Promotion Division and other line ministry departments, agencies, implementation partners, and donors, joins all partners in launching this laudable document, namely the Health Promotion Policy, the National Strategic Plan for Health Promotion, the Knowledge Management Guidelines, Media Engagement Strategy, the Counseling Flip Chart on Household Practices. Our hope and desire is to see this document generate momentum and catalyze innovation action through implementation, leveraging lessons learned at all levels with flexibility to course correct at needs be. Thank you very much for your attention, and congratulations for this great milestone.
Thank you very much. Congratulations all the way. One arm of government that is important to what we are doing is the legislator, or the legislative arm, and representing all that in spite of the very short notice and the fact that time is ticking for him to go to another engagement as he prepares to travel, and I wish you a very safe journey, my brother. I'd like to introduce my own senator, Senator Ibrahim Oloriegbe, who is chairman, Senate Committee on Health from Kwara State. For emphasis.
Thank you very much, Muji. Honorable Ministers, distinguished ladies and gentlemen, to be able to save time. It's my pleasure to be here as a member of what I will call the first arm of government, because without the legislators, we cannot be speaking of a democracy. I've been asked to speak on our commitment towards this policy. And I must say that, if we are legislators, as representatives of the people, we must be committed to the health of our people. Health is very important. Without the people being healthy, they will not participate in any governance process, will not get elected. And without people being healthy, we will not be seen to be doing our work. And to underscore this commitment, I want to say that legislators are known for three main functions. the legislature, we perform the function of legislation, representation, and oversight. And we use all this process to support health promotion. My understanding of health promotion is far broader than what has been spoken since. Because WHO definition of health as a state of complete physical, mental, and social well-being is very germane to know that being healthy does not mean that there's no disease. It's not without absence of disease. But it means we have to look at it from a broader perspective. As such, what we do in legislators is not only what we do in the health sector that we promote health, it's what we do in other sectors. And hence, if you look at social determinants of health, which are grouped into 5, 3 are very critical. The behavioral activities of people, the social factors, and as well as environmental and physical factors are critical for us to do health. I want to say that currently in the National Assembly, we have several bills that are being proposed which are relevant to promoting health. One on genetics. Currently my committee is considering a bill on sickle cell disease and how we can support and promote it. Because without preventing sickle cell occurrence, we are going to be having a lot of people that are the children and even adults that are maimed by that. Also, we have some considerations of improving the behavioral changes of people through, we have a bill on how we strengthen the current anti-tobacco bill, how we make it strengthened to be able to make it more functional. We have several other bills that seek to look at health promotion. I want to say that the legislator, the 9th National Assembly, is committed to supporting this policy as well as all those other legislations that I have said that we lead to promotion of health. On the final note, our understanding of health promotion also cut across. You know, we look at it as prevention, but health as a spectrum, look at promotion, prevention, then we have curative and rehabilitative. At every stage, it's not only from promotion side, it's not only from prevention side. Even at curative, if there's no adequate information to a patient, that patient will not be able to take the treatment that is required. Just like the Honorable Minister of Human Affairs said, a woman that wants to go to the hospital, if that needs permission of her husband, and without adequate promotion between the communities, it means the husband will still be insisting on giving permission. But it's by understanding the fact that health is a right, the woman does not need your permission to be able to go and so on. So that's what I'm talking. So that is at a curative stage, it's not a preventive stage, because the woman in labor requires services. So as such, I look at it that as legislators, during our campaign, during our interactions with all our electorates, we will be promoting health. On this note, I want to congratulate the ministries for reviewing the health promotion policy. I was privileged to be part of the 2006 policy. I was then the Executive Secretary of Health Reform Foundation, and I was very critical in the development of the 2006 policy. So I'm quite happy and pleased that I'm part of this review and the new one, and particularly the strategic documents that are developed. So we are committed not only to supporting the policy in terms of implementation, but to support all other aspects that will help in promoting health. Thank you, and God bless.
Thank you very much, distinguished Senator Olori Egbe. Thank you dearly. We'll move on straight to key statement from the Honorable Minister of State for Health, Federal Minister of Health, Senator Dr. Adeleke Olorunnibe Mamura. Sir, you have the floor, and thank you for your time.
Thank you very much, Madam Moji.
Thank you.
Well, the chairman of the Senate Committee on Health, Dr. Olori Egbe, I hope you know the meaning of that. Olori Egbe is the head of a group or society or whatever. So there couldn't have been a better person to be chairman. the Honorable Minister of Health, our revered religious leader here present, permit me to just at this point say, distinguished ladies and gentlemen, it is my pleasure and privilege to deliver these key statements as we launch the National Health Promotion Policy and its ancillary strategic policy documents. Indeed, it is an honor for Nigeria and the Ministry of Health to envision a population equipped with appropriate, adequate, and effective health information to take timely actions in disease prevention and increase control over their health. Due to globalization and other factors, the country is experiencing drastic changes in the rise of threats to its healthcare system, ranging from the reproductive, maternal, newborn, child, adolescents, elderly, as well as nutrition factors, consumption patterns of alcohol and tobacco. Thus, disease patterns are changing with more people affected by cancers, diabetes, and hypertension. Mental health conditions, road traffic crashes, domestic violence, unsafe sex, and insufficient physical activity are also on the rise. Other threats to the Nigerian populace include insecurity, floods, poverty, unemployment, and infectious and communicable diseases. The Federal Ministry of Health developed the National Health Promotion Policy in 2006 to strengthen the health promotion capacity of the national health system to deliver health care that is promotive, protective, preventive, restorative, and rehabilitative to every citizen of the country. However, the implementation of the maiden policy was affected by some challenges such as weak intersectoral collaboration, weak management structures, poor infrastructure, and limited understanding of the concept of health promotion and consumer rights at all levels. These gaps, current trends in health promotion practices, as well as emerging and re-emerging health issues of public health importance, informed the revision of the 2006 edition. The robust health promotion policy of 2019 and its ancillary strategic policy documents took cognizance of the fact that people have a right to good health and well-being. The revised policy of 2019 begets the maiden 5-year National Strategic Plan for Health Promotion 2020 to 2024 and aims to provide strategic steps to guide the implementation of the National Health Promotion Policy. In addition, in this area of digitalization, the Knowledge Management Guideline for Health Promotion 2024 will provide a roadmap on effective documentation, dissemination, and archiving of all related health information within the health sector in Nigeria. The revised policy also recognizes that health financing and implementation is beyond the government. Therefore, invaluable positive roles will be played by the donor agencies, private sector, non-governmental organizations, philanthropists, academia, civil society organizations, the media, the traditional and religious leaders in disease prevention, improving health and well-being, as well as taking measures that ensure a healthy society. Let me seize this opportunity to appreciate all our partners who have been in the forefront of supporting the ongoing government efforts at repositioning health promotion programming in Nigeria. I want to believe all of us here present, physically and those online, will do everything possible to ensure that we are not just hearers of the word, but doers. And on that note, I thank you for your kind attention.
Thank you very much. Emphasis on implementation, emphasis on self-discipline, emphasis on the fact that all of us have a stake in this. Moving on first, I'd like to call on the Director, Head Health Promotion Division, Federal Ministry of Health, Mrs. Ladidi Bako Ayegusi, to give us a presentation on empowering Nigerians for healthy living, the journey we have so far.
Honorable Minister, sir, Honorable Minister of State, sir, our religious father, development partners, implementing partners, distinguished ladies and gentlemen, both present here and virtual. I will quickly talk about how do we want to empower Nigerians for healthier living. The mandate of the Federal Ministry of Health states as follows: provision of quality stewardship and services for the health of all Nigerians, irrespective of who you are, irrespective of where you live, either in the urban or in the rural, in the remotest place in this country, irrespective of your literacy, whether you are educated or not, irrespective of your ability. And for us to meet that responsibility, then it is both individual and collectively the responsibility of all health workers, managers, caregivers. Distinguished participants, the general perception of health services is often limited to, but not restricted to, infrastructure, quality of staff. We believe once there are staff in the facility, we believe everything is all right. Once there are protocols, guidelines, policies, we feel the health system is okay. Once there is availability of equipment, commodities, consumables, likewise, as far as we believe if we are able to manage illnesses, then the health services has been provided as required. But on careful examination, the significant percentage of the factors that characterize healthy living goes beyond putting in place a well-equipped health system, health facility. It goes beyond having in place a well-case management system. For anyone to be healthy, be you a newborn baby, an adult, adolescent, or an older person, there are certain factors that need to be put in place. And beside accidents, infections, and genetic makeup, which we do not have control over, a wide range of lifestyle, social, economic, and environmental factors may affect personal and indeed population health. This collectively is referred to as the social determinants of health. These are factors that influence one's health status, essentially because of how and where a person lives, works, and interacts with people. Distinguished ladies and gentlemen, the health of an individual is not only impacted by the quality of health services, the nutrition, what you eat, what you drink, how you prepare it, your health literacy, the basic information about what to do to protect yourself, the gender, the male and the female, the rights, the family status, how economically viable is the family, do you have access to clean water, how sustainable is the clean water that you have, the sanitation, how clean is the environment, security issues. There are so many lists that we cannot exhaust it. If the Federal Ministry of Health must fulfill its mandate of providing quality stewardship and services for the health of all Nigerians, our perspective of the meaning of services must assume a more holistic scope. Our services must include, but not limited to, collaborating with a wide range of sectors, strategically positioned, and equipped to address these social determinants. And I'm really very happy today that we've seen this. We are not only talking, we are also acting. In the forum this morning, we have seen that it is not just a health issue. Health promotion cuts across all sectors. It also means that we must strengthen our capacity to drive health literacy and encourage personal responsibility for healthy choices. Distinguished ladies and gentlemen, I'm really very glad and honored to inform you that the policies that Honorable Minister is launching today, or we have trained the providers, we have trained the partners on the implementation of this policy. It is no longer business as usual. There is a repositioning of health promotion in this country. Health promotion is stepping out of its dark stage and coming out into visibility. Health promotion is taking its rightful place in the health sector because people must be empowered to do the right thing. We want people, when they wake up in the morning, they should think about health promotion. When they enter their bedroom to take their bath, they are thinking about health promotion. When they are cooking their breakfast, they are thinking about health promotion. When they are eating their breakfast on the dining table, they are thinking about health promotion. When they are leaving their homes and they are locking the door, they are thinking about health promotion. When they are on the road to their places of work, they are thinking about health promotion. That is what we want. Health promotion is not a program, but a way of life. And that is what we want it to be. Honorable Minister, sir, the definition of health promotion is well known to all of us. And this is as far back as 1986, when it was agreed that for us to reduce the burden of diseases, then we need to improve and adopt health promotion. So health promotion involves a set of actions. It increases individual, family, and community institutional participation in health. It is cost-effective and it increases the use of available health services through multi-sectoral collaboration, partnership, networking, and alliance, just as we are doing right now. So how do we ensure that individuals make healthy choices? Honorable Minister, sir, every day, individuals make many choices. As before we came here this morning, I'm sure a lot of us, we took decisions. What color of dress should I wear? What shoes should I wear? How should I fix my hair, especially with the ladies? But when it comes to making decisions that keep an individual healthy, like what type of food to eat at a particular time of the day, going to the health facility for regular medical checkup, these decisions are usually taken, Honorable Minister, without taking note of the health implications. So, what do we want to do with the repositioning of health promotion? We want to improve the enabling policy environment for the Federal Ministry of Health to fulfill its mandate. We want people to engage in regular and moderate physical activity. We want people to start doing simple things every day that will keep their body healthy, that will make them to live a healthy lifestyle. We want people to be sleeping under mosquito nets without being coerced. We want people to start eating to ensure when they eat there is fruit in every diet. We also want to let people know that there are benefits of making healthy choices. Honorable Minister, the benefits are to the individual and likewise to the nation as a whole. There will be a change in the negative personal behavior, practices, and lifestyle if we're able to reposition health promotion effectively. There will be improved quality of life, improved life expectancy, and there will be reduced money spent on treatment of diseases. So the nation, there will be reduced level of illness, diseases, and injury. There will be reduced crime level in the country. And there will be reduced financial costs to the national health system and the government. And there will be increased manpower output by reducing absenteeism due to ill health. Distinguished ladies and gentlemen, what are our commitments to ensuring that Nigerians are appropriately empowered? The revised National Health Promotion Policy aims to facilitate health promotion interventions that will ensure and sustain healthy behavior, healthy lifestyle, enabling environment that will empower Nigerians to make informed choices, a healthier living. It is our sincere hope that through the efficient and effective rollout and implementation of this health promotion strategic policy document, the Federal Ministry of Health will be driving the process of empowering Nigerians for healthier living. Distinguished ladies and gentlemen, I want to say thank you so much for your attention.
Thank you very much. That sets the pace at which the health promotion would work, and hoping that since we have everybody trained, as it were, it will cascade fast to every nook and cranny of Nigeria. The honorable ministers in absentia and those who are watching us by online, I would say that we are now at the crossroad where what brought us here has to be made public. That is the national presentation of the National Health Promotion Policy and its ancillary strategic policy documents. They are ready. I can read them out as I invite the Honorable Minister to the microphone, who would do the ministerial launch. That the documents include National Health Promotion Policy, National Strategic Plan for Health Promotion 2020 to 2024, Counseling on Key Household Practices is a flip chart, and Knowledge Management Guideline for Health Promotion 2020 to 2024. On your behalf, very distinguished ladies and gentlemen, I'd like to invite the Honorable Minister for Health and Federal Ministry of Health, Dr. E. Osage Ehanire, to please do that launching for us. And shall we please welcome him most warmly. This is innovative. It's the first time in the world we've heard so that countries have seriously adapted health promotion. You have the microphone, Honorable Minister.
Thank you, Moji. Let me still greet everybody happy good morning and recognize the dignitaries who have been here today, the Honorable Minister of Women Affairs, the Honorable Minister of Environment, the Chair of the House of the Senate Committee on Health, who have all had to leave because they had many other engagements to attend to. The Honorable Minister of State, the representative of the interfaith body, Bishop Onoha, representative of the World Health Organization, representative of the National Primary Healthcare Development Agency, UNICEF, and all others who have joined us today and who have already spoken. I welcome you. This is a very, very important program for the Federal Ministry of Health, and it is my pleasure to play the lead role at this pivotal event in the journey to reposition and refocus health promotion, which is a critical part of the mandate of the Federal Ministry of Health. This landmark event to present, launch, and disseminate the revised National Health Promotion Policy of 2019 and its ancillary strategic policy documents is timely and desirable because it aims to actualize federal government's commitment to improving health and well-being of Nigerians by highlighting options to making healthier lifestyle choices. It demonstrates that the Ministry of Health is not only just concerned with treating illnesses, but also with attaining and sustaining good citizen and population health so that more people can enjoy good health and fewer people will become sick. These policy documents will provide guidance for the empowerment of individuals, families, households, groups, and communities with the appropriate information on helpful habits and steps and behaviors to maintain good health and reduce the burden of communicable and non-communicable diseases, but also to inform on the negative impact of certain practices. The World Health Organization has defined health as not only the absence of disease, but being the state of physical, mental, and social well-being. And that is very important for us to take note of. Health is generally said is wealth. But we do have available evidence that shows that conditions under which people are born, conditions under which they grow, conditions under which they live, work, and age, and the systems in place to handle ill health do determine the overall health outcomes of people. You have heard much said today that your health depends first on the choices you make, but also on things which you cannot choose. The air you breathe, for example, the water you drink. And today we have had the presence of two ministers, the Minister of Environment, in whose portfolio will rest responsibility for the air we breathe, the quality of air, also the surrounding, the state of hygiene, the state of sanitation, and then the Minister of Women Affairs, who has emphasized that the women are responsible for the household. They are responsible for what we eat. And what we eat plays a big role in what we are. There's a parable that says that you are what you eat. And that's exactly why it is important that promoting health will bring you many benefits. Number one, you are happier. You are happier. People who have good health, you generally can see it in them. Number two, they are more productive. They work, and those who are doing, even if you are molding blocks, you can mold 10 blocks if you are not feeling well. But once you are feeling very well, feeling healthy, you can mold 20. That is productivity. And then the benefit of health promotion again is that it's cheaper for government because you have to treat less people. You have to buy fewer medicines. You have to do fewer operations because people are generally healthy. And of course, finally, people live longer. It gives you long, enjoyable, beneficial life. Therefore, health education in communities and settings such as schools, workplace, and worship centers present an opportunity to disseminate information on health and to impart the life skills that promote healthy lives and better health-seeking behavior, which should remain with us throughout life. Health promotion as a concept began at the first Global Conference on Health Promotion in Ottawa, Canada in 1986 as part of the search for effective means of preventing disease and improving living conditions. The popular saying that prevention is better than cure also implies that it is a cheaper and more cost-effective path to reducing illness, including diseases of public health threat. The African region of the WHO identified health promotion as one of 6 strategic directions for addressing priority public health. Ladies and gentlemen, the Federal Ministry of Health, on acknowledging the benefit of scaled-up health promotion activities in addressing the increasing burden of diseases, disability, and premature deaths from preventable causes, conducted an assessment in 2004 in collaboration with relevant partners, an assessment of the capacity of our health sector to implement health education programs. The findings revealed limited technical capacity and the need for a framework and the linkages across all levels of healthcare in the country, through the states and local governments, right down to the ward level and the community and family level. The outcome of that study is the maiden National Health Promotion Policy of 2006, developed by the Federal Ministry of Health in collaboration with stakeholders to strengthen health education capacity in our health system, to fulfill the policy objective of improving the health status of the population. Health promotion activities at national and subnational levels are central to providing the basic minimum package of healthcare services, which is provided by the Primary Healthcare Development Agency, who is here present and represented today, and coordinated by the Health Promotion Division of the Department of Family Health at the Federal Ministry of Health, and supported by the National Health Promotion Forum after the maiden National Health Promotion Policy was launched. The forum that I speak of is a multi-sectoral technical advisory group focused on strengthening collaboration to implement the National Health Promotion Policy nationwide. Membership is by institutional representation by designated focal persons. I commend the effort of the forum and seize this opportunity to solicit their continued partnership to better the health status of Nigerians through this program. The question on the lips of many of us must be, what have we achieved? Though progress has been grudgingly slow over the last decade, I am pleased to say that we have made modest advances in a few areas of health promotion programming, which include building capacity and an emergency and an enabling policy environment, awareness creation, institutionalization at state level, and also baseline assessments are what we have done, among others. And despite efforts of government and partners to build healthy, safe environment in communities through public education on sanitation, hygiene, healthy living, along with preventive health services at both clinical and community settings, significant challenges still remain with us. We are making efforts to reposition and strengthen coordination and stewardship of health promotion programs at all governance levels to improve community participation, which is critical, and their empowerment, and the delivery of interventions, as well as evidence generation to guide further steps and achieve sustainable financing to support the initiative. Poor health-seeking behavior is still rampant in our communities, and this feeds directly into poor health indices. This can be changed with adoption of simple household health practices in all settings. More investment in health education is not only just worthwhile, it will eventually save costs and support socio-economic development, which I earlier spoke of. Ladies and gentlemen, major policy documents, including the National Health Act of 2014, the National Health Policy of 2016, and the second National Strategic Health Development Plan of 2018 and 2022, all concur that health promotion is Nigeria's means to reducing the overall burden of disease through behavior and lifestyle changes, but also through improvement to our environment. Both improvement in the air we breathe, in what we eat, and the water we drink. And also in our practices. But the reality around institutionalization of health promotion does not yet support all the contentions that we are making. Going forward, we shall make diligent effort to uncover the challenges around health promotion programming. However, we have developed policy and strategic documents that should see health promotion become a contributor to the achievement of the health-related sustainable development goal number 3 and the attainment of universal health coverage. We must also realize that addressing the question of the social determinants of health and achieving health equity requires actions and partnerships which stretch beyond the health sector. I shall be glad to welcome you all to join hands with us to examine those social determinants of health from our various and diverse vantage points and to strive to contribute what we can to address inequity and also to adopt healthy lifestyles and promote health for better health outcomes. I have the pleasure of inviting your attention as I make public the presentation of 5 important health promotion strategic policy documents today. Thereafter, a result-oriented subnational level launch and dissemination is to follow. These strategic policy documents include, number 1, the National Health Promotion Policy of 2019 to contribute to achieving Nigeria's national health policy commitment to deliver preventive, promotive, curative, protective, restorative, rehabilitative, and even palliative health care to every citizen. Number 2, the National Strategic Plan for Health Promotion 2020 to 2024. The maiden 5-year National Strategic Plan for Health Promotion of 2020 to 2024 showcases Nigeria's commitment to bridging the gap between policy and implementation, now customized to addressing the context and the peculiarities of health promotion, particularly in every state. Number 3, Knowledge Management Guideline for Health Promotion of 2020 to 2024, a tool to guide the fundamental requirement to institutionalize knowledge management practices for health promotion. It defines the core element of knowledge management, namely to capture, generation, synthesis, storage, archiving, retrieval, and sharing of knowledge and information. Number 4, the counseling flip chart on key household practices to empower individuals with the right information, the right knowledge, and the right skills to improve their health-seeking behavior by adopting simple practices that improve child survival, that will improve maternal, adolescent, and elderly health, growth, and development. Number 5, the counseling flip chart on family planning and child spacing to empower individuals with the appropriate information and knowledge to find outlets for safe and trusted family planning services and make decisions that increase family planning service uptake, thereby improving health and well-being of families. I shall just use this opportunity to stress that the health and well-being of women depends heavily on how the children are spaced in a way that their bodies can be able to recover, in a way that they're able to look after the children they have had, that no child is disadvantaged and none are left on their own at an early age. That's where family planning comes in, to be able to look after the children that God has blessed us with by using our senses and our knowledge to space correctly and care for each one the way the good Lord wants us to care for them. Ladies and gentlemen, our dear traditional and spiritual leaders, friends, I'm optimistic that the information and education that the revised National Health Promotion Policy and its ancillary strategic policy documents provide not only fosters sectoral and intersectoral collaboration to deliver key interventions, but will empower the people to easily make healthy choices of their own free volition. To conclude, I count on the partnership and support of all stakeholders, joining hands to reposition the health promotion agenda and actualize a campaign promise of President Muhammadu Buhari, which says to improve the health and well-being of Nigerians through promotion of healthy lifestyle. It's an item in his agenda. The roadmap for healthy living, the roadmap for health promotion, for productive life, is with us. It is up to us all now to walk that road. Thank you very much for your attention.
Honorable Minister, sir, we want you to do the public launch, please, and may I join? Yes. The best. Yes. Sir. May I please invite the NUJ president also to come along? It's a free service. Okay. This way, sir. We are to the center. the vote of thanks. 1 minute from the Director of Family Health. 1 minute, please. Thank you. Please allow the Honorable Minister to be seated.
Okay, thank you very much, Auntie Moji, my sister, my friend, the Honorable Minister of Health, the Honorable Minister of State Health, our religious leader, Bishop Sunday Onoha, representing the Sultan, His Eminence, Sultan of Sokoto, and also representing the chairman of CAN, Christian Association of Nigeria, the WHO representative, all agencies that are represented here, both physically and online, all our development partners, all the media men that are here with us today, distinguished ladies and gentlemen. A good afternoon to you all. I stand, Honorable Minister, on the existing protocol. I think my job here is to appreciate everyone on behalf of the Honorable Minister of Health. It has clearly been said, and we have seen the renewed commitment. We have to wake up in the morning. We didn't know why the minister said it should start at 9 o'clock, because we thought it was too early. The WHO rep said I had to wake up this morning into health promotion. And I think that's the strong message. We wake up very early in the morning to think of health promotion. What lifestyle changes are we going to do today? And this is how we started the day, Honorable Minister. We appreciate that wisdom. And this is the take-home message: to promote, protect, support, restore, rehabilitate, and the minister added, including palliation. There is no better time than now to act on health promotion. We have seen the devastating effect of the COVID-19 on our economy, especially on the health sector. So we have to wisely think of how to reposition and take care of ourselves, and how to take responsibility for all our actions. We've learned not to stay too close together. And I think this is going to be one of these lifestyle changes that we have learned from the COVID pandemic. I want to thank everyone, especially the two ministers that joined us this morning. The Minister of Women Affairs, my big auntie, Dame Pauline Tallinn, for her passion for women, and for her support to the Honorable Minister of Health. She said, I'm going to drive it home. I think this is part of our responsibility. And I also want to appreciate the Minister of Environment, who also, despite the very short notice, was able to join us this morning. I'm happy he said it himself, that health and environment are like Siamese twins. So with little effort, he was able to join us this morning and to ensure that we strengthen the partnership. We have been working together. Honorable Minister, sir, on behalf of you, I want to appreciate sincerely our religious leader that is here with us today. Bishop Sunday Onoha has been a partner in the journey of promotion of health in Nigeria. And I'm happy that he is representing His Eminence, the Sultan of Sokoto, who is the chairman of the National Council on Islamic Affairs in Nigeria, and also the chairman of the Christian Association of Nigeria. You know why we felt religion is next to godliness, as it is always said. We cannot achieve without working with the religious leaders. Our religious father, we thank you for sparing time to come here to join us this morning. I think it is a worthwhile time invested in the health of Nigerians. Permit me to appreciate all the agencies that we work together. We have all seen the demonstration of partnership in this room today. The DG, National Primary Healthcare Development Agency, who has a big responsibility in delivery of services at the community level. He has been doing it with his team, and he would have loved to be with us here. He is well represented by Chief Chris, who has been a very close partner from the MTH CDA,
who has his hands and vast experience in immunization activities, which is one of the greatest success stories that we have when it comes to working with communities and making it to happen. Thank you so much, and extend our appreciation to my brother Faisal. I want to appreciate all our other relevant agencies that are here, NAFDAC, NCDC, the National Orientation Agency, and all partners that have sacrificed the time to join us here this morning, to say a big thank you on behalf of the Honorable Ministry of Health. I will not leave without appreciating the media. We don't have the mouth to talk. We are technical people. But I think the media are our great partners. And part of what we have launched today is also the media engagement guidelines. We want them to give the correct information, adequate information, on how to protect, promote, prevent ill health in Nigeria. At the same time, how to restore it and rehabilitate it. So I want to appreciate you and look forward to your continuous partnership. Honorable Minister, sir, I also want to extend appreciation to WHO, represented by the WHO representative himself, who was here, I think, at around exactly 9 o'clock, because he woke up this morning to think of health promotion. Thank you so much, sir. Same goes to all the UN agencies we have been working, especially UNICEF and UNFPA. I want to appreciate our development partners, USAID, FCDO, Bill and Melinda Gates Foundation, for the support they continuously continue to produce to support us in all aspects of healthcare delivery in Nigeria, particularly supporting the Health Promotion Division to achieve all these laudable achievements. It is indeed, sir, a laudable achievement, distinguished ladies and gentlemen. We have worked on the policy for quite some time, but with COVID, we realized gaps. And within a very short time, from March till today, we have developed 4 additional documents that will bridge the gaps. I want to sincerely appreciate all our development partners, the civil society organization, all implementing partners that have contributed to this. This time around, as one of my colleagues said, we are doing it differently. We are not developing documents before, after the launch, we distribute. These documents have been distributed already. They are all at the state level. So we have moved away from the usual way we distribute documents and then we start developing and then it stays on the shelf. We are doing an action-oriented dissemination. Not only in the state level, the documents we have used to train the people that will use the document, the health promotion officers from all the 36 states of the Federation. So they are just ready to go as we launch this document. And I want to thank all our partners that joined us in this journey to realize a different way of doing it, an action-oriented launch, dissemination of our document. And I'm sure that with all these efforts, it will make a big difference. I should not forget to appreciate our partner in the legislation, Senator, though he has just left, Senator Yahaya Olorunbe, who has been very supportive, whom I always say, we don't need to advocate to you. You have been with us in the journey of health. And I'm happy that he is walking that talk. We want to appreciate him, and we want him to be our ambassador as he talks with his colleagues in the Senate and the House of Representatives, to be on the side of health so that we don't have to do much, but to have sustainable financing and to ensure that health promotion is a household name in all nooks and corners of Nigeria. There is so much to thank everyone, but I will not forget also the Health Promotion Division. Mrs. Bako, if I said I'm passionate about the health of the family, sometimes I say she's much more passionate than myself. So when she said, the director, you should make this presentation, I said, no, you are more passionate than me when it comes to health promotion. Please go ahead and do the presentation. And I think she made an excellent presentation. I want to appreciate her and the team that are working with her, despite the fact that she keeps on telling we are too small, but I think we have seen a demonstration of how small can really work big. I want to say thank you to all of you for the work you have done, especially from March till December, to help us achieve all these documents that will bridge the gaps. My auntie, my sister, Moji, I want to say a very big thank you. Moji has been working with us. I think I have been working with her for over 20 years. And all the time, it's not about funding. It's not about how much I pay her. We can't afford to pay Moji. We did not ask any partner to pay her. But we really appreciate the sacrifices. She's a stakeholder, and this is how I always call her. She's a stakeholder. She's a partner in progress, and she has given enough of her time to really work with us to ensure that healthcare delivery in Nigeria achieved the desirable outcomes as we wanted. And when she heard about health promotion launch, the notice was very short. She stepped down a lot of her activities that were to start from 9 a.m. today and said, I will be with you to ensure that we deliver the message on health promotion. A very big thank you, my very good sister. So thank you so much, and I want to say thanks to everyone. I want to appreciate everybody. Lastly is to say that it is a joint responsibility. It is a journey that we have all started. No one can do it alone. We have to work together. We have the documents that will guide us on how to do it. We're not only looking at it at institutional level, we're also looking at it at home level. And as what you have seen was launched today, is also counseling at the household level. So we have brought very closely very close to the family, the issues of health. It is everyone's responsibility. And we look forward to see that we do this journey within the next few months, immediately, and change the narrative of healthcare in Nigeria. As it was said, more than 70% of our health problems are preventable with lifestyle changes, with adoption of health promotion messages. Thank you so much. And I wish you all safe journey back to your offices, those online, back to your work. Thank you.
Thank you very much, Director, Family Health Department. Well, that's it for today's event. Have a wonderful day in Abuja, and stay healthy and keep healthy.